Hi everyone, my name is Bridget Nelson and I am a graduate assistant in the Office of Health Promotion and Wellness Services. Today I'm going to be presenting to you about A Healthier You, Auburn University's campaign to address and promote control of the spread of coronavirus. Let me share my screen here. There we go. All right. So I'm sure you guys have heard and seen everywhere the A Healthier You kind of logo, campaign. It's been all over town, all over campus. Today we're going to talk about prevention and bystander intervention for COVID-19 and kind of what that looks like. So A Healthier You begins with your commitment and individual choices to protect and promote good health. Part of your commitment is to look out for your fellow classmates and members of the Auburn community in general. Protecting the Auburn community is our collective responsibility, and that's going to happen by making individual choices on a daily basis. The health, well-being, and safety of the Auburn family depends on each of us doing our part. So you guys can kind of tell here, there's a really big emphasis on individual decisions that really create a more collective message across our campus. So we've got some things that we're asking everyone to commit to this fall. And those are wearing a mask or a face covering, hand washing, keeping a physical distance, avoiding crowds when possible, and the daily health check survey. One thing that I like to talk about in terms of being a bystander and this kind of presentation is hope. So hope is tied to our responsibility, and we have control over what our community will look like. We can make a true impact and create a healthier you when we choose commitments to guide our behavior. I think that it's really easy to be kind of doom and gloom during this time and during this pandemic and this weird fall semester of uncertainty. But I think it's really important to find things that we still are hopeful for. I have a lot of hopes for this fall semester despite everything going on. And I hope that you guys will take some time to kind of think about what you are still hopeful for and what kind of keeps you going to get through this pandemic. So in order for A Healthier You to kind of be effective and to create that collective message that I was talking about, there's two ideas that we've got to believe in, every single person on our campus. And those two ideas are really simple. They are that we can prevent the spread of COVID-19 and everyone does their part in preventing the spread. If everyone can get on board with these two ideas, we will be able to make a huge difference and keep a lot of people on our campus and in our communities safe this fall. All right, so let's kind of break down this list of commitments that I talked about in the beginning. So face covering or masks, just some guidelines. They should cover your mouth, nose, and chin, fit snugly and comfortably, be securely tied with ties or ear loops, be made of multiple layers of fabric, allow for breathing without restriction, and be able to be laundered and machine dried without damaging or changing the shape of the mask. Just some extra kind of tips on mask hygiene. When you remove your mask or face covering, be really careful to avoid touching your eyes, nose, or mouth. And wash your mask after each use, and wash your hands after removing the mask from your face. Hand washing. Frequent hand washing can remove infectious particles from your hands that may have been acquired from touching different objects throughout the day. This presentation has a pretty strong emphasis on hand washing over hand sanitizer. Hand sanitizer is great. You know, we see it everywhere. It's very convenient. It's at the stores when you check out. It's in doorways when you walk into a building. But just keep in mind that hand washing is much more preferred over hand sanitizer whenever possible. And that's kind of what this next slide addresses. That's definitely not to say we shouldn't use hand sanitizer. We can and we should. And we should be aware that hand washing is more effective in controlling the spread of germs. Hand sanitizer does not get rid of all types of germs. It may not be as effective when hands are visibly dirty or greasy. I think we've all done that when we have like dirt on our hands and use hand sanitizer, and it just kind of smears the dirt everywhere. It's kind of gross. And another guideline is make sure the hand sanitizer that you're using is more than 60% alcohol. This is going to make it a lot more effective if it's got that higher alcohol content. If you need to use hand sanitizer rather than washing your hands, be sure to wash your hands with soap and water as soon as possible. All right, keeping a physical distance. This is going to really reduce the risk of breathing in infected droplets. So as you guys have heard all summer long, the guideline is 6 feet. Limiting gatherings that require close contact and hosting virtual meetings whenever possible are some other strategies to address the physical distance. Avoiding crowds. We want to make sure that we're respecting communal spaces and limiting the number of people of sharing these spaces. Don't share. I know it sounds really easy, but it's so automatic, you know, like someone's like, oh, can I use your pencil? Of course, you know, but really, really be intentional. Don't share phones, computers, especially if you think about your keyboard, that's got a lot of germs on it. Makeup, don't share face coverings or masks or any other personal items. I'm thinking about people who live in on-campus housing or the dorms, right? Like when I was in college, we shared everything. Just be really mindful of that this semester. I think that's going to be really important, not to share things. Eliminate handouts and giveaways on the concourse and programming events as much as possible. Unfortunately, I think there's going to be a lot less free food being given out this semester just as a precaution. Be aware of commonly crowded spaces and take a different route whenever possible. If you typically walk to campus and walk through like that Tiger Transit, super busy stretch outside the stadium, try and avoid that if you can, if you're not catching a bus. Find your quarantine, right? I think it's really easy to focus on everything we can't do right now, but a quarantine is something we can do. Find a small group of friends you plan to spend your free time with this semester. Make a bunch of TikToks. You guys might get famous, who knows? So find your team. Find things that you can do outside. You know, there's tons of stuff in the area, in the community, nearby that are able to be done outside and with that kind of social distance in place. Daily tracking of your health. So Auburn's got its very own daily health tracking system. This green screen, that's what we're going for. You can use this on your phones. It's going to be found under the My Campus tab. So if you go into your AU Access account, click on the My Campus tab. It's going to be linked right at the top there. Complete it each day before you go on campus. Anything but a green screen, you're going to want to check in with a med clinic or a doctor of some kind when you can, or as soon as possible, really. The AU Med Clinic is going to be recommending tests when they find it appropriate. So just make sure you're consulting with someone in healthcare, a professional that you trust if you're getting anything but a green screen. All right, let's move on to being a bystander and promoting A Healthier You. So one of the things we can do as bystanders is define your boundaries and respecting others. So we've got to recognize that everyone has a different comfort level in terms of what they're willing to participate in this fall. Remember that many Auburn students, faculty, and staff are at a higher risk for more severe cases of COVID. And the thing about this that's really tricky is we may not always know when others fall into a high-risk category. You can't always tell by looking at someone if they're really immunocompromised. Sometimes you can, but a lot of times you can't. And so we want to be really mindful of that. And some things to consider for yourself in setting these boundaries is consider who you live with, consider recent and upcoming travel. I know that I'm going home to see my parents in the middle of October, and they're older, right? So starting at the beginning of October, I'm going to be really cautious about the contact that I'm having with other people and honestly trying to avoid it as much as I possibly can. Attending classes, consider your state and regional mandates, who you plan to spend time with during the next 14 days. Respect others' boundaries and unwillingness to participate in something, especially when it's different from your comfort level. I kind of talked about that earlier. Just be mindful of you never really know kind of what's going on for someone. So if they're not comfortable doing something, kind of honor that and just kind of move on. All right, being an active bystander. This means recognizing when a situation is potentially harmful and being willing to intervene for the good of the Auburn community. To promote a healthier you, this might look like noticing someone who's not wearing a mask on campus, noticing someone not keeping their physical distance in class, someone overcrowding at Tiger Transit, or a roommate not completing their daily health checker before going to class. So what can we do in these situations, right? Like we see people overcrowding, we see people not wearing masks. What do we do? And if you guys are familiar with our green dot intervention strategy, the 3 Ds are going to be a way to remember what our options are in terms of intervening as a bystander. So we've got direct, which is addressing the behavior directly to the person who you see doing it and modeling appropriate behavior. Delegate, finding someone who is better positioned or equipped to step in and ask them to intervene. And defend, support the bystander who has chosen to intervene, especially when doing so at a personal risk. We're kind of going to get into each one of these in a little bit more detail, but these are just some options that we have to intervene as a bystander, and you only have to pick one. Sometimes situations will lead to more than one, but really these can be used on their own. So directly addressing behavior would look like saying something like, please wash your hands, or could you give me some space, please? Or no worries, I'll take the next elevator. And the last one, excuse me, but masks are required to be in the building. Delegate, finding someone who is better positioned or equipped to step in and ask them to intervene. I saw a few people packing the elevator. Can you help? Saying to your professor, Dr. Thompson, can you remind the class about wearing masks today, please? Dr. Cam, I have a roommate who will not fill out their health screening daily. What should I do? Some people that come to mind for who to delegate to would be anyone who's working for the university, faculty, staff person. You can also delegate to a peer, right? So if you need help kind of addressing a situation, see if one of your friends will help you. Also, a tip that we use in Green Dot is finding someone who's really outspoken and really, those friends who will always speak up. Find a friend like that and ask them to help you intervene. And defend. Support the bystander who has chosen to intervene, especially when doing so at a personal risk. So for this one, we really want to promote good bystander behavior. So if you see someone, maybe it's an RA, maybe it's a person you've never talked to in your life, maybe it's like a grad student or something. If you see someone intervening and saying, hey, could you please wear your mask? Or, hey, could you please use this hand sanitizer before you check out at Chick-fil-A? I don't know. If you see someone intervening as an active bystander, we really want to defend those people. There's strength in numbers, and we really want to encourage them and promote that message. So maybe if you're in a group of people and someone says to the person next to you, hey, could you wear a mask? Really support them and be like, yeah, like no big deal. Just like put your mask on. It's okay. We don't these situations don't have to escalate. And I think that they can communicate a really strong message when there's more than one person kind of correcting or promoting healthier precautions. All right, and here's some resources for you guys. So we've got the AU Med Clinic here. They're doing telehealth visits for anything. So COVID symptoms, not COVID symptoms, give them a call. If you're not sure, they'll be able to walk you through kind of how they're doing their procedures and stuff. Health promotion and wellness services, we've got all of our stuff going on via telehealth. So Safe Harbor, nutrition services, substance use services, we're still doing it all, just mostly over Zoom. Student counseling and psychological services, they are also kind of have their own protocol for how they're doing their services right now. So just give them a call and they'd be happy to kind of walk you through those options. And then of course our website, ahealthieru.auburn.edu. I hope you guys enjoyed this presentation. Have a great fall semester and War Eagle!